Want to study in Germany? Then Excella is the best option. Admissions with scholarships available. Call 9881 96666.
నెఫ్రోటిక్ సిండ్రోమ్ అంటే ఏమిటి, అసలు ఇది ఎవరిలో ఎక్కువగా వస్తుంది, ఇది ఎందుకు వస్తుంది అనే అంశాల గురించి మనతో మాట్లాడేందుకు ప్రముఖ చిల్డ్రన్స్ నెఫ్రాలజీ స్పెషలిస్ట్ డాక్టర్ విజయలక్ష్మి గారు మనతో ఉన్నారు. విజయలక్ష్మి గారు నమస్తే. నెఫ్రోటిక్ సిండ్రోమ్ అంటే ఏంటి, అసలు ఇది తరచుగా ఎవరిలో వస్తుంది, ఇది ఎందుకు వస్తుంది?
Nephrotic syndrome is a disease related to kidney. It is mostly the disease it happen in pediatric age group. Kidney is the filtration organ in our body. It filtrate blood and return back all the essential elements to the body like protein, sugar, calcium, phosphorus, magnesium and other essential salt. And remove some waste product from blood like urea and creatinine. This is a condition something happen wrong in that filtration barrier that causes heavy loss of protein from kidney. So that due to this condition the child develop a generalized swelling. So because of the protein loss there is severe swelling in the body. Usually it starts from around the eye and gradually progress to leg and belly and it becomes generalized. So you call the term it generalized progressive swelling. It most commonly happen in the age group of 2 to 8 year age. In overall world population the common incidence is usually 2 to 4 per 1 lakh population. But in our Indian population, the incidence is little more, means occurrence is little more. It occurs around 9 to 10 children per 1 lakh population. The reason is unknown why it happen more in Indian population, but it is seen that we have more occurrence of the disease in children as in general population.
ఓకే, విజయలక్ష్మి గారు, ఈ నెఫ్రోటిక్ సిండ్రోమ్ వచ్చే ముందు లేదా వచ్చిన తరువాత ఏ లక్షణాలు ఎక్కువగా కనిపిస్తాయి?
Okay. Symptoms happen and then there is a heavy loss of protein from kidney. So there is a low protein level in the blood in body. So usually symptom is generalized swelling. Swelling usually as I told before, swelling usually starts from the around the eye, usually more prominent in the early morning. Then it gradually progress to leg and abdomen and progress to general whole body. And sometimes it associated with some complications like infection. So child may present with high grade fever, with loose motion, vomiting, belly ache, and sometimes decreased alertness, like child may develop a fits with generalized swelling with all that complication child may also present. And some children have decreased urinations, means the fluid from that blood vessel due to low protein in the blood level, due to loss in the kidney, it leaked from blood vessel to that other body tissue. So the fluid level in that blood vessel is decreased, so for which that child develop decreased urination.
విజయలక్ష్మి గారు, నెఫ్రోటిక్ సిండ్రోమ్ వ్యాధిని అసలు ఎలా గుర్తించాలి?
Nephrotic syndrome, first any child which develops generalized swelling, we diagnose with protein loss in the urine. So first we have to do a urine protein test. That we can do in a dipstick test. Dipsticks means there is a strip, it is coated with reagent. So when you dip the strip in the urine, there is a multiple color. This color code was assigned with some progressive +1, +2, +3 and +4. Usually in nephrotic syndrome the protein loss is very heavy protein, massive proteinuria we called it. So the protein loss is more than 3+. That we can interpret from the color code of the strip. After that we can do a blood test. Blood test usually protein level is low, so usually in children protein level is 3.5 to 4.5 gram per deciliter, but here due to heavy loss of protein in urine, the protein level decrease below 3 gram per deciliter. Then next is due to protein loss there is compensatory increase in cholesterol in the body, so child have a high cholesterol level in the blood. So you can diagnose it in these three conditions, like any child with swelling, heavy loss of protein in urine like 3 plus protein, along with low protein in the blood that is less than 3 gram per deciliter, then we can diagnose a nephrotic syndrome. Then if other additional test we can do to rule out the complications, like if child having problem in breathing, so we have to do a x-ray to check if there is any pneumonia. If child have any seizure, we have to do other blood test like serum sodium potassium to check if there is any dyselectrolytemia. Then if child is decreased urination, we have to do a blood serum, urea and creatinine to see if there is a kidney failure. Some child also they present with kidney failure because of that infection, because of severe dehydration, because of the fluid loss from the body due to loose motion, due to vomiting. So according to the symptoms child present, we have to do the additional test.
నెఫ్రోటిక్ సిండ్రోమ్కి భారతదేశంలో ఎటువంటి ట్రీట్మెంట్ ఉంది?
Treatment of nephrotic syndrome, mainly we treat nephrotic syndrome with steroid, that is oral prednisolone mostly. If 90% of child respond to very well with this treatment, they cure with this treatment. Usually in the first episode, when the child present to us first time with generalized body swelling and we diagnose nephrotic syndrome, around 90% of child responded to this steroid, and 10% of child that does not respond to steroid. So usually steroid course is we give 6 weeks of very high dose of steroid, that is daily steroid therapy, followed by that is we call 60 milligram per meter square of body surface area, followed by low dose of steroid, that is 40 milligram per body surface area for another 6 weeks. Usually in the first episode they develop remission. Remission means child develop that is child cure, protein become nil in urine, nil or stress, or urine protein creatinine ratio become less than 0.2. So it happen within 14 days of treatment. Some child sir they respond after 4 weeks of treatment, so that child we call late responder. And few like 5 to 10% child they don't respond to steroid treatment. This child we call as steroid resistant nephrotic syndrome. So for steroid resistant nephrotic syndrome, again treatment protocol is different, but before starting treatment we have to do a renal biopsy. Renal biopsy means we have to take a small piece of kidney tissue from the kidney, that is called biopsy gun. So that tissue usually we study under the microscope, and we specify the what is the type of histological nature of the disease. Accordingly we start treatment. The second line therapies are like tacrolimus and cyclosporin for the steroid resistant nephrotic syndrome. Again, who have responded to steroid, some child around 15 to 20% child they don't have relapse or don't reoccur the disease. Those are lucky children. But another 30 to 40% of children they develop repeated swelling, that is called relapse, around less than 4 times a year. So that child also we treat with steroid because they prednisolone, because they responded well to treatment. So around another 30 to 40% of children they develop relapse, that is reoccurrence of swelling, more than 4 times or more than 4 times a year. Usually they for these children we prefer a second line treatment. So the second line drugs are like levamisole, cyclophosphamide, mycophenolate mofetil, and rituximab. So again we have to we know there is several side effect of steroid and second line drugs also. So common side effects of steroids are like child will have high appetite, they will be very hungry, so they will eat very well, they develop weight gain, and they may develop a high bp, that called hypertension. So we have to uh, 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 take care of this side effect also. So when the child, even if they are infrequent relapse, like less than 3 no, 4 times in a year, they have developed relapse. But if they have side effect of steroid, then also we have to treat them with a second line drug. And we have to consider the side effect of second line drug also. So we have to monitor them very frequently when the child is having a second line drug, or we treat the child with a second line drug.
విజయలక్ష్మి గారు, నెఫ్రోటిక్ సిండ్రోమ్తో బాధపడే పిల్లల్ని ఏ పరిస్థితుల్లో హాస్పిటల్లో అడ్మిట్ చేయాల్సిన పరిస్థితి ఉంటుంది?
There are some danger sign, that is they need urgent hospitalization, like high grade fever, loose motion, vomiting, any child decrease alertness, child is looking sick, that and child having a stomach pain, that belly ache. So those group of child definitely have a severe infection or some other related problem like clotting inside the blood. They need urgent hospitalization that could not be managed at home.
ఓకే, విజయలక్ష్మి గారు, నెఫ్రోటిక్ సిండ్రోమ్తో బాధపడేవారు ఎటువంటి జాగ్రత్తలు తీసుకోవాలి? వాళ్ళ పేరెంట్స్కి మీరు ఇచ్చే సలహాలు ఏంటి?
So any child we diagnose with nephrotic syndrome, we have to train parents how to pick this danger sign, so they can take their child immediately to hospital. And there are several conditions, their child may have a proteinuria or protein leaking in urine, like any fever, any small cough and cold infection, minor infection. So on those conditions, and child is having not any danger sign what I told before, so parents can monitor the child in home by doing a simple urine test, that is deep stick test. Parent usually trained what is the color code given, it is 1+, 2+, or 3+. If it is less than 3+ and child is not having any danger sign, so parents can treat their child at home with a small dose of steroid according to the body weight of the child, what is advised by the treating physician. But if child having any serious complication like fever, loose motion, decreased alertness, or any blood in urine, dead urine also, that is also a danger sign. Or child having dipstick test protein showing more than 3+, those child immediately should be taken to a doctor to give a proper treatment.
ఓకే విజయలక్ష్మి గారు, నమస్తే.
Thank you.